Magandang araw, Ilocos. Welcome sa show na tumatalakay sa ating kalusugan, ang Cure. Dito mapag-uusapan ng mga karamdaman o iba't ibang klase ng sakit at kung paano sila may iwasan. Magandang araw, Manong Nonit.
Good day, Dr. Elton. Before we start our show today, I would like to introduce our specialist for today. She is the chairman of the Department of Pediatrics in Gabriela Silang Hospital and holds her clinic at Liberation Boulevard in Vigan City. And she also is an active consultant in St. James Hospital, Lajos Hospital, and Rabara Hospital. May I introduce to you our lovely Dr. Blandina Suarez.
Hi, classmate. Hi, Elton.
Ate. Ngayon naman, mapunta na tayo sa main topic natin dahil marami nang nagkakasakit dito sa Ilocos ng dengue. Pag napabayaan ito, maaari itong ikamatay ng pasyente. Here in Ilocos Sur alone, umaabot na sa 478 ang dengue cases as of July 2012. Kaya naman it is proper for us to be aware sa sakit na ito at dapat ding malaman kung saan ito nakukuha at how it can be treated. Doktora, ano po ba ang dengue at anong klaseng lamok ang nagkakaroon o nagdadala ng dengue virus?
Ang dengue infection ay it's the most common mosquito-borne viral infection, especially here in the Philippines. And this is caused by the bite of the infected female Aedes aegypti mosquito.
What do you mean by a female infected Aedes aegypti mosquito, Dr.?
When you say infected, ito yung lamok na nakakagat na ng pasyenteng may sakit na dengue. So it gets infected. Okay. And specifically, it should be a female Aedes aegypti mosquito because they need the blood meal for laying their eggs.
I see. So, you mean to say, if we talk about the life cycle of the Aedes aegypti, Doktora, for example, may isang identified mosquito. Paano siya may infect ng dengue ngayon? Where will the mosquito get the virus?
The mosquito will get the virus from the infected patient. Kakagatin niya ngayon kasi ganito yan. Only the female mosquito will be infected because ito lang yung kumakagat. Okay? Because the male mosquito, for your information, ang kinakain niya ay fruits lang fruits.
And it's just for propagation.
Walang silbi ang mga lalaki.
Walang silbi.
It's just for propagation.
Yeah,
May
that's
silbi.
right.
For propagation.
Oo. For procreation. So ngayon, pag nakakagat na siya, yung female mosquito, nagmo-multiply ngayon yung virus sa salivary glands nila. So that when they bite you, for example,
That's when you get infected.
That's when you get infected.
I see, okay.
Okay. So when you are bitten by the mosquito, nagkakaroon ka ngayon ng yung tinatawag na incubation period. That is the time when the dengue virus multiplies in your blood.
Gets introduced to the bloodstream until it comes out as signs and symptoms of the patient, right? So, ang infected individual ba, Doktora, do they get, is there a person-to-person spread?
Person-to-person spread is hindi nagkakaroon ng ganun. There should be a mosquito that will bite you and then yung mosquito na yon, di ba? Pag binite niya si Elton, kunwari, nagkaka-infect din siya. Okay?
Tapos ako naman, magta-transmit naman sa another mosquito.
Another mosquito.
And then it's another mosquito that would bite another person.
Me.
So, mosquito man.
So it
So
cannot...
actually, yung mosquito ang nahawa.
So tayo ang naghahawa dun sa mosquito ng dengue. Parang
Because
ganon.
sa atin nila nakukuha. Although, hindi natin alam which comes first. Di ba?
Which came first, the chicken or the egg?
The egg or the chicken.
Pero how long will it take for the person to manifest with signs and symptoms kapag nakagat na siya nung lamok na may
Incubation period.
Yeah, the incubation period, it will depend now on the viral load, di ba? Kung mas madami yung dengue virus na napunta sa'yo, then you will have a shorter incubation period. But more or less, it will be 1 week.
Question, Blands. Pag nakagat ka ba ng isang lamok, may infect ka na? Does it have to be one mosquito or several mosquitoes?
Actually, pag meron kang isang bite, di ba? Remember that the virus will multiply. So, isa lang could infect you.
It could be.
Yeah.
I see.
And then
Okay.
it will multiply.
It will
And then
multiply.
it will take mga 7 to 14 days before you manifest with
Yes.
signs and symptoms. So,
Or shorter,
Oo.
depending now on your immunity and on the viral load.
okay, so talking about signs and symptoms, ano ba ang kadalasang mga manifestation or nararamdaman ng isang nagka-dengue?
It's like according to patients, 'di ba, yung sinasabi nila and when you interview them, ang nararamdaman nila is of course meron silang fever, and aside from that, yung mga signs and symptoms ng flu. Okay? Meron silang headache that is very very prominent. Yung iba sumasakit ang mata, nahihilo sila, sumasakit yung katawan, mga bone pains. Yon ang mga nararamdaman nila. Others, they also have sore throat, they also have diarrhea. That's why you should be very careful because you may present with diarrhea but yun pala, meron ka palang dengue.
So, parang initially, parang trangkaso lang.
Oo, para siyang
Flu-like.
trangkaso.
Flu-like. And
And-
then it will be only the lab examinations that would tell you that there is dengue.
That is not necessary as long as, 'di ba, kagaya ngayon, this time marami tayong cases ng dengue. So you should always have high index of suspicion
Especially now.
yeah, that
Rainy season
this might
and it's a dengue season.
this case might be dengue.
Pero so, usually, anong mga edad ang naapektuhan ng dengue?
All age range are affected, although it is more common among children.
Why?
Probably because they are more active. Kaya nga, one of the characteristics of this, if I may tell it now,
Of course.
Yeah.
Why not?
Meron silang mga peculiar characteristics, di ba? This Aedes aegypti mosquito, they are day biting. Tapos gusto nila they want their victim to be very active probably because they love warm-blooded animals
That's
like
right.
like us because yun
when
nga
you are
eh,
active, you
you're
generate heat.
heat.
Yes. And this mosquito seek that
Yeah.
type of...
Kaya yung mga bata dapat careful.
Pero saan
so it's
sila,
the children.
saan sila usually mga nakatira? Yung mga mosquito
Mga
na to?
mosquito. That is why they are called domesticated or urbanized, di ba? Laking syudad na sila.
Nag-adapt na sila sa mga pollution and everything.
Yeah. They dwell in our houses kasi gusto nila yung mga dark corners and they love to lay their eggs on clean water. Kaya yung ating mga water storage containers, that is the place where they usually lay their eggs.
Okay, and then they bite during the morning ba?
Yeah, they are day biters, usually 2 hours after sunrise and then 2 hours before sunset.
That's so
okay.
specific.
Yun
Oo.
yung kanilang happy hour.
Pero meron akong parang napanood na
Happy hour
commercial.
Happy hour nila yon.
Pero parang may napanood ako na commercial na parang yung mosquito daw, sometimes they also bite at night na. May commercial ngayon.
Oo.
Think so.
Yeah,
Yeah.
actually, alam mo naman yan, nag-ano sila eh, they come to adapt already with the environment and with the climate change, 'di ba? Kasi this is the reason why probably before, 'di ba, wala naman tayong case. Bakit nung bata ka ba, Elton, meron ka bang masyadong naririnig?
Yeah, that's right.
Oh, wala, 'di ba? But how come?
Kaso lang siya.
Ikaw ba nagka-dengue ka
Oo.
nung
Ako
bata ka?
nagka-dengue.
Ako rin.
Oo. Parang wala akong naririnig na meron tayong dengue infection
How come, Doctor?
before.
Is there an
But
explanation for that?
probably because of pollution, increase in the population. Siyempre, pag dumadami ang population kasi, the more garbage we throw,
The
di
more
ba?
they thrive on those
Yeah.
factors.
And this, yung mga garbage na yan, if they decay, nagkakaroon ka na ngayon ng methane gas. Diba? So what happens? Kagaya ng greenhouse effect. That is why nagiging warm ngayon yung environment. And this becomes very conducive for the survival of the Aedes aegypti.
I see. Okay, so Dr. Elton?
Sige. Ayan mga kaibigan, dyan lang kayo at marami pa tayong malalaman tungkol sa dengue. Cure will be right back.